Hello, everyone. My name is Shivangi Sharma, and I'm a second-year master's student in the Psychology and Education program at the Department of Counseling and Clinical Psychology at Teachers College, Columbia University. My study is an exploratory study which aims to assess the mental health needs of Syrian refugee fathers who have resettled in Elizabeth, located in New Jersey, in the last 5 years. So this study aims to understand the psychological needs of Syrian refugee fathers, as there is a dearth in research on mental health needs of refugee men. So we hypothesize that Syrian refugee fathers will have clinically significant symptoms of depression, anxiety, PTSD, and worse mental health symptoms due to low help-seeking behaviors. So for this study, participants will be recruited from the Syrian Refugee Literacy Program, which is a tutoring and mentoring program for refugee children in Elizabeth, New Jersey. So this study uses a mixed method design, which consists of both quantitative and qualitative measures. So for the quantitative measures, we will be giving 300 refugee fathers, Syrian refugees. So for the quantitative measures, we will be giving 300 participants a demographics questionnaire, the Kessler Psychological Distress Scale, which assesses anxiety and depressive symptoms, and also the PCL-5, which assesses PTSD. So for qualitative research, we will be conducting personal interviews and focus group discussions with 10 Syrian refugee fathers. So we anticipate that the participants will likely be low income, on subsidized housing, Muslim, ages ranging between 35 and 60 years. And we expect that Syrian refugee fathers will report clinically significant symptoms of depression and anxiety, which is 22 or above on the K-10, and clinically significant PTSD symptoms, which is 33 or above on the PCL-5. And qualitative measures are likely going to reveal that language and cultural barrier, as well as cultural stigma surrounding mental health, are the primary reasons for Syrian refugee fathers' low help-seeking behavior. Additionally, we expect that Syrian refugee fathers will most likely attribute their mental health symptoms to psychosomatic symptoms. So similar to studies conducted on refugee fathers in Australia and Iraqi refugee mothers, we expect that Syrian refugee fathers will report high levels of depression and emotional distress. It is also expected that Syrian refugee fathers will report cultural stigma around mental health, language barrier, as well as the scarce culturally appropriate coping strategies and therapeutic interventions in Western countries as the primary reasons for their low mental health seeking behavior. So in the future, we hope that future studies will focus on creating culturally appropriate coping strategies and therapeutic interventions, which will include the use of local idioms, as well as cultural and religious terminology in treatment. So as we have seen that there is a constant influx of refugees from Syria, and more recently from Afghanistan, which only emphasizes the need to improve the low help-seeking behavior, as well as the barriers to mental health in Western countries. Thank you.